Hi, I'm Kirsten Prispilski, and I'm a DIM and PA student. And what's your name?
Heidi.
It's nice to meet you.
Nice to meet you.
And what brings you in today?
I want to talk about Chantix.
So Chantix is also known as varenicline. It's a prescription medication that we use to help patients quit smoking.
And how does it work?
So there's two mechanisms of action that Chantix has. So it's a partial agonist to the nicotinic receptors, and all that means is that it works at the same receptors that the nicotine from a normal cigarette would work at, and it kind of binds and causes the release of dopamine. And this hormone is the feel-good hormone of the body, and that kind of gives you the buzz from the cigarette. And then it's also a competitive antagonist to the nicotinic receptors. So say you were to smoke when you're using this medication, it would block that nicotine from the cigarette from binding, so it gives you less of that feel-good feeling that you'd normally get when you smoke a cigarette.
And how long will this treatment last?
So you set a quit date, and then you start the Chantix 1 week prior to the quit date, and then it's a 12-week treatment period.
And is this method efficacious?
So Chantix is the most efficacious monotherapy that we have to help patients quit smoking.
And what are the benefits of Chantix?
So one of the benefits of Chantix is that it doesn't have nicotine in it, so it's not like a nicotine replacement. So we're actually just taking nicotine out of your routine and your daily life, which is a good aspect. And then also, as I said, it's the most efficacious monotherapy at helping crave or cut withdrawal symptoms of smoking. And also, it has like a different mechanism of action from other nicotine therapies. So if you have had previous failures with other treatments, this one may actually help to quit the smoking for you.
Any side effects?
So some of the side effects may include like nausea, constipation, sleep disturbance, and like flatulence.
Any reasons why I wouldn't be able to take it?
Yeah, so if you had any like renal disease, you wouldn't be able to take it. If you were pregnant or breastfeeding, it's another like reason that you wouldn't be able to take it. If you had like a severe allergic reaction to this medication in the past, it's another reason that we wouldn't allow you to take the medication. And then also if you had like any neurologic or like psychiatric symptoms on this medication, we would take you off of it.
And how much does Chantix cost?
So Chantix is a twice daily dosing. So 2 pills costs $15.90 about. So we're looking at probably like a monthly cost of $450 to $500. So it's more on the expensive side of our options of quitting smoking, but we can look into like if your insurance might cover it or like an RX coupon for you at the pharmacy.
And I was also warning about the nicotine patch.
So the Nicoderm patch is an over-the-counter medication that you can get over the counter. So it's a patch that goes on your body. You can put it on like your arm, your back, or your chest, and it releases a small amount of nicotine, which is what's in the cigarette. However, it's at a lower dose, and it doesn't have all the other chemicals that a cigarette does. So it works at the same receptors, the nicotinic receptors, and it causes release of that dopamine, and it's that feel-good hormone that kind of gives you that buzz, but it's without all those chemicals, and it's at a lower dose as well.
And how long do I use the patch?
So a patch goes on the body, and you use a patch a day, so for 24 hours. You kind of rotate where the patch goes, so if you had a patch on your arm for one day, you'd want to move it around. And then treatment for the patch is about 8 to 12 weeks.
And how efficacious is the patch?
So the patch, we say, is about 50 to 70% efficacious, so it helps that many people in quitting smoking.
And the benefits of it?
So it's a once daily dosing, so it's kind of helpful in patients' compliance because they only have to put the patch on and they don't have to worry about it for 24 hours. And then they also can use it in combination with other nicotine therapies. So if you wanted to like use the nicotine gum or like a nicotine lozenge, you'd be able to use those as well with this. And then another benefit is that it's kind of like a hidden option, so other people wouldn't know you were on it. You can like put it on your body and other people wouldn't see it. So that's another plus.
Okay, and any side effects?
So because it's an adhesive, it can cause some skin irritation to the site that you put the patch on. That's why we recommend switching the patch wherever. And then also it can cause some sleep disturbance. So if you were to have sleep disturbance, you can actually take the patch off prior to bed and then sleep without the patch and then put another patch on in the morning.
Okay. Any reasons I shouldn't take it?
So if you were to have had like a myocardial infarction, like a heart attack within 2 weeks, we wouldn't let you take it. Or if you had like heart arrhythmias, chest pain or angina, if you were pregnant, we also wouldn't let you use the patch.
And how much does this cost?
So the patch is $1.50 to $3.50 per patch. So it's one of the more inexpensive options of quitting smoking.
Okay, perfect.
And did you have any other questions?
I do not. You answered them all. Thank you.
Thank you so much.
Thanks.